Hello.
Good afternoon. How are you?
I'm very well, thank you. How are you?
I'm not too bad. The sun's shining. It's a bit cold, but
Yes, yeah.
yes.
It's lovely where I am here as well. The sun's light and we got a conservative. It's too hot.
Oh wow, that's great. That's lovely.
Yeah, you've been well.
Yes. I'm enjoying the new lockdown roadmap. Everything's been a bit more relaxed. I saw
That's why, yeah.
saw my nan for the first time in about a year. It was lovely. It was so nice.
Oh, really nice. That's nice. Yeah, that's good.
Hi Fiona.
Hello.
How are you?
I'm fine, thank you. Hang on, what's going on? You've gone. Let me just find. Sorry, yes, I'm fine, very well. Sorry, I've missed the last couple. The weather's been nice and there's been a nice horse to go and see. So
No, I don't blame you. Don't worry, Fiona. I'm just going to give it. We've got quite a lot to get through today, but I'm just going to give it a couple of minutes, and then we'll kick off. We normally have these in the evenings. I'm sure you're aware. So we might get perhaps different people today than usual. Doing it at 3 o'clock. We just wanted to change the times around a little bit, just so it suits everybody.
Yeah, good. It's nice to have that flexibility, isn't it?
Definitely. Oh, hi, Steph.
Hello, you all right?
I am. Yes, are you?
Good, yeah, not too bad, thank you. Not too bad. It's nice to see a bit of sunshine this week, always makes a difference.
It's lovely, isn't it? It's so lovely.
Yeah.
Definitely needed, I think.
No, certainly lifts the spirits.
I'll start in about a minute. I'm just gonna wait for my colleagues to join. Then we'll kick off.
Are you still having to work from home or you have to go back to the office?
We're working from home still. I think we will be going back into the office gradually. I think with the view to perhaps work from home sometimes, but also go to the office as well. A bit of a mix, which would be nice.
Yeah, that's good. Yeah, good. Well, the good thing about this pandemic, well, if you can say the good thing, I suppose the flexibility for workers to work from home has been, approved really now because it's doable.
Definitely. People have more options than I think that probably ever did before. It's definitely a positive, like you say, of the pandemic.
Yeah.
Right, I'm just going to share my screen, and I think we'll start. Bear with me. Okay, so when I share my screen, I can't see the chat box. I do apologise. If anyone's got anything to say, please feel free just to come off mute or raise your hand. It's no problem. So the agenda for today, we're going to obviously do a quick introduction and go over house rules. There might be some new people on this call. We then have our Arts and Culture Officer, Hannah Thomas, here to discuss the COVID arts projects that are happening in Birmingham, which is really exciting. We are then going to do just a short social media survey, really, but just quite interactive whilst we're on this webinar together, just to understand how you use social media, how perhaps we can improve our social media, just to help improve our offering. We then have a public health update from Madupe that will go over the roadmap and home testing. And again, if you have any questions, please feel free to ask. We then also have a vaccination update with Dr. Rizwan Aladina from the CCG. And again, if you have any questions, please always feel free to ask. Because we have got quite a lot to go through, I'm going to just kick off. I'll do a really short introduction, and then we can move on to Hannah. So welcome everybody. I know there's some new faces on this call today. We tried to, I was just saying before perhaps you joined, we've been trying to change the times around a little bit so everyone gets a chance to join. Because the evenings aren't suitable for some people, the mornings perhaps are more suitable for others, for example. So we've been trying to do an array of different times, but it's great to see you. So I've mentioned the agenda. As I say, if you have any questions, feel free to pop them in the chat box. Or if you want to come off mute again, please feel free. This is a conversation for us all to have, and not just a one-way dialogue. If you can stay on mute perhaps while the presenters are speaking, that would be great. And yeah, let's just get started, shall we? Hannah, are you here?
Yes, I am. Sorry, it was taking me a very long time to get off mute.
Don't worry.
Hello, everybody. My name is Hannah Thomas. I'm the Public Health Culture Officer, and I just wanted to just take 5 minutes of your time just to present and tell you about some of the projects that I've got, which are focusing on things like vaccination, uptake, and messaging, and kind of all of the preventative measures that we can take as a community to stop the stop the spread of COVID-19. So I am going to share my screen, if I'm allowed. Can people see my screen okay?
Yes, perfect, Hannah.
Okay, brilliant, thank you. So we are going to be just looking over the creative COVID engagement that we've got happening. So firstly, the aims of the projects are to promote continued awareness of COVID-19, vaccine uptake, forge positive relationships with community groups, volunteers and citizens, and encourage compliance and capture the community experiences, along with promoting the COVID Champions programme. So everything that you're involved with, we would really like more COVID champions in Birmingham, which would be fantastic. So just to say here that there are 13 projects that we're doing, and they all have digital and non-digital elements to them. So it goes on a project by project basis as to what you might be able to engage it in your own home, or it might be in your local community. The projects will run from April. So at the moment we're in recruitment and planning stage, and they will be ending at all different points, some of them in May, July, June and August. So we've got a nice spread of projects throughout kind of these next 6 months. So just these are some it's not giving justice to the fantastic work that's happening, but we've got some of these themes coming through. So things like dance projects, there's going to be hopefully a citywide flash mob that people can be doing inside their homes, getting people active. We've got things like video creation with young children, creative writing, poetry, podcasts, mask making for friends and family. So there's kind of lots of different activities that will be happening. And the age ranges for them all vary, so they're project by project. So how can you as a COVID champion, or you as a member of Birmingham City get involved? So you could either do some volunteering if you wanted, you could be a participant, you could be just an audience member, or you could simply just be shouting and championing the work that's kind of going on within the city. It's very simple. It's just kind of that's it. I really think, because every project will have a different take on it. So what I was going to do is, in the weekly newsletters that you get, highlight some ones that are going into a bit more detail, so that you can know what might be happening in your area or might be happening citywide, because some of the projects involve all citizens and some of them are working in specific areas. And if you are interested, this is my email address. It's hannah.thomas@birmingham.gov.uk, or you could always email the COVID Champions box, and I can get those messages sent over to me, however that might be. But I just wanted to let you know that it was going on, because it's sort of celebrating the work that you're all doing. That's it really. Does anyone have any questions, or I forgot how I stopped sharing my screen. There we go. It's a long time since I've used Zoom.
Sorry, that was really. Oh, sorry.
Hannah, I would like to say a very interesting, informative presentation, and it's really useful for everyone in the city to participate in. And Ramadan Mubarak to you as well.
Oh, thank you very much, Ramadan Mubarak. Yeah, it's at least it's not very warm, so I'm enjoying Ramadan so far. Thank you very much.
Excellent.
I was just going to ask Hannah, so do you know, obviously we can pop these in the newsletters that the champions get. Do you know roughly when the first one will be?
So the first culmination of a project is going to be in May, and that's a series of podcasts that are going to be with young children that they're doing in school. So I think the age range is around 14 to 16. So that is the first project that's going to be done. Obviously, we might not be able to have recruitment from this particular group with that one per se, but we can then share it and champion it. Some projects will be running from May until June, and then some will be running sort of June to July. So there's a very varied scope of project delivery. And so if anyone is really interested in doing something in the summer holidays, if they've got like children or large extended families, I can put them in contact with the project managers, and we can kind of work around that way.
That sounds really good. I don't actually think they're on the call today, but we often get asked by just by a handful of people about volunteering, so that I know that it'll be of interest, and that's fantastic. Thank you for sharing this with us.
So I know that just to bring up on that, so I know the volunteering opportunities will be with the 60+ community. So there's going to be a poetry project with people in a residential home. So if anyone's interested in engaging with the elder citizens, they will be volunteering. I know that's a specific volunteering opportunity.
Okay, that's great. Does anybody else have any questions for Hannah? No, I guess not. Well, if you do, you've got Hannah's email, or you can email us. And yeah, thank you very much for sharing that, Hannah.
It's okay. Thank you very much for having me. I hope everyone has a lovely day, and Ramadan Mubarak to anyone else in the room that's celebrating.
Oh, thank you. You too, Hannah.
Thank you. All the best.
Bye.
So bear with me. I'm just going to share my screen. So the next part of today's meeting, we're going to be using Mentimeter. Has anybody used this before? I know we have done in some of these sessions. What you need to do is you need to go to menti.com on your laptop or your iPad, or even your smartphone, and just type in that code at the top. So 92375022. I'm just going to pop that in the chat as well for you. If anyone has difficulty, please let me know, and I can talk you through how to get on there. Oh, we've got some people in already. So yeah, the first question is, do you use social media? We'll just wait for some more people to join before I move on to the next slide. We've got more people, 10 people.
The only thing I would say, Holly, in terms of social media, for example, I only use LinkedIn and emails. I don't use Facebook, for example. So does it matter which aspect of the social media we use?
No, so in a minute I'll break it down a bit further, but at the minute it's just a yes or no, but that's really useful. Thank you for sharing that. Okay, I think we'll move on to the next question. So which social media platforms do you use? And you can select as many, or as few. It's up to you. Depends on which one do you use most regularly. And this is just for us. So we have our Healthy Brum, sort of Birmingham City Council public health social media platforms. We're just trying to understand, I guess, how many of you use them, and so what platforms you use at the moment, just to help sort of shape our plan moving forward. So a lot for Facebook.
Sorry, Holly, we haven't got LinkedIn on there.
I haven't got LinkedIn on this one because we don't actually have a Healthy Brum LinkedIn account as such. Does anybody else on this webinar use LinkedIn as well? Because it would just be good to understand if that is quite popular.
Do you mean a work account, Holly?
I guess either. I guess work or yeah. I guess so. Yeah.
Well, I know at BVSC there's a few colleagues that use it and will share and promote on there at times, including myself.
Okay, that's good to know. Thank you, Steph.
Yeah, no problem.
So Instagram not as popular as Facebook. That's interesting. I'm just going to go to the next question. So yeah, are you aware of Healthy Brum? No, I guess do you have us on social media? And that's for any platform. That's great. So the majority do. We'll go to the next question. So you might be aware of us, but yeah, do you actually follow us on social media? Don't feel like you have to. Of course you don't. But I'm just quite intrigued. So a lot of you perhaps are aware of Healthy Brum, but don't follow us. Does anybody perhaps want to come off mute and perhaps just explain why? I mean, there's no right or wrong answer here, and we're just intrigued. That's all.
The only social media I use is obviously email and LinkedIn, and I always normally check my emails for any Healthy Brum news that comes through. So I think it depends on personal choice, because social media can overtake your life with everything that's available. So I'm always very selective to how much I spend time on and what's real adds value to my thinking and what I need to be aware of.
No, definitely. And does anybody else have any thoughts?
Yeah, Holly, I use Facebook, but I use it as a library. I put this in the chat room directly to you, actually. I use it as a library resource for a couple of specific things I'm interested in. So I don't get involved in chats. I don't get involved in friends. I just follow a couple of groups that have things that I want to find out about, and I dip into them a couple of times a week.
I see. Okay, that's interesting. So
that could be an age thing. Frankly, I have a life. And in my life, there is no time for rubbish like social media and the minutiae of it.
Okay, no, that's really helpful. Thank you, Fiona.
Another Fiona here, Fiona Adams.
Oh, hi, Fiona.
I just use Twitter, and I follow you on Twitter. You do tweet a lot, so I could imagine some people might think, gosh, there's a lot of tweets. But anyway, I follow you on Twitter.
Well, thanks for following us, Fiona, and again, thank you for the feedback as well. Right, I'm going to go to the next question. So yeah, if you do follow us, you'll see our posts on all the platforms. Do you share those? Do you engage with them? Yeah, yes, no, or sometimes. So yeah, the majority sometimes. Okay, and we'll move to the next question. Apologies for these being quite small, so I'll read them out. So yeah, what would you like to see more of on our social media platforms? You've got live videos, latest guidance, interviews, vaccine information, testing information, perhaps wider COVID topics. You've got mental health, physical health, healthy eating, Perhaps you want more polls, more testimonials, or other. And if you put other, please do feel to come off mute and let us know what that is. And you can press as many as you like. So the two people that have put other, please don't feel like you have to. If you'd like to come off mute and perhaps give us some more information, that would be really, really helpful.
I put other. I've been interested when I've been able to find information that I can pass on via WhatsApp to my friend who speaks Urdu.
Okay.
So when I've seen information that's in Urdu, I've been able to copy it and put it into WhatsApp and send it to her.
That's really useful. Thank you, Fiona. Anybody else?
Yeah, the other Fiona again.
Oh, hi, Fiona.
I put other because I really would have wanted a not applicable on the basis that I don't follow you on social media and I don't see you on social media.
Okay, I see. Okay, I understand. So I guess latest guidance has come up top: vaccine information, testing information, and just wider topics. This is really useful. Thank you so much. So I think we'll move on, unless anyone's got anything else perhaps to add about social media.
Sorry, Holly, with the pandemic, sadly, there's a lot of mental health issues and domestic abuse for a variety of reasons.
Yeah.
And I think people in the community do need a lot of support and awareness of how to seek help for domestic violence and mental health issues that they're experiencing. So anything that will promote that will be really helpful.
Thank you for that. So we were meant to have a session, I think it was last week, about, well, not about mental health in general, but about grief and bereavement support. That is now, I guess, just to update you all, it has been moved to the second week of May. It's actually Mental Health Awareness Week that week, so we thought it would tie in quite nicely. If you would like more, perhaps wider mental health, I guess, webinars as well, and we can put domestic abuse in there as well in terms of support locally. Perhaps we can aim to do them that week, if you like. If other people find that useful, then it might
that would be really good with some contact details or a phone number that we can pass on to people who are going through and say, this is the contact you need to get help. So, we can actually give information that people can then act on.
Sure, thank you. That sounds really good. We'll aim to get something for that first week of May then.
Thank you.
So we'll move on to the public health update. Now, before I hand you over to Madupe, I wanted to set the scene a little bit and just ask one final question. So bear with me. So from the 9th of April, you can now order rapid test kits to your home. Were you aware of this? And then, again, no correct answer, just please be honest. So yeah, that was what day was that? Last Friday. Yeah, I actually ordered mine on Friday. It came first thing Saturday morning at 7 a.m. and I was really impressed, actually. I've got it here. Yeah, really, really impressed. So 11 people have put yes. Okay, well, on that note, I'm going to hand you over to Madupe to talk about the roadmap and home testing. I'm going to stop sharing my screen. Hi, Madupe, are you with us?
Yes, I am. Hello, everyone. Thanks, Holly.
Hi, Madupe.
I wasn't sure if I was meant to be participating in that. So, yeah, I did put some answers in myself. Very interesting survey. Thank you. And hello to everyone. I might start with a brief summary of where we're at, I think, and then, as Holly's mentioned, tell you a bit about the roadmap, which I'm sure most of you know about already, but we could take questions maybe if there are specific areas that people want clarity on, and also feedback on your observations of what you think is happening in the community, because you are quite instrumental for us in trying to get a picture of what we can do as public health to support people as we ease lockdown across the city. I don't know if you can hear me properly because I'm using my a small device on this Zoom call. So apologies if it's a bit faint. So this time, I think last week, we weren't sure where we were going to be at, and a lot of people were looking forward to easing lockdown. And what we've been doing before now is keeping an eye on the rates of infection to inform us, because as we know, the government stage roadmap talks about the areas that we will focus on to determine whether or not the roadmap will be going according to plan. So those key areas were making sure the hospitals were no longer filling up with people unwell with COVID-19. It was also to ensure that we were not having, sadly, people dying from COVID-19. We were also keeping an eye on the R rate, which is the number of people that someone with COVID subsequently infects with COVID-19. And we were also keeping an eye on the variants, which I'm sure many of you have heard about, and which have been an area of concern as we rolled out a vaccination program to stop the spread of COVID-19 and to support us to go back to normal. So the good news is that the infection rates have been going down steadily across England and in the city. We've seen that the rates of infection have between the previous week up until the end of last Friday gone down from 532 from 46.6 per 100,000 to 26.8 per 100,000, which is nearly halved the infection rate. So that's brilliant. And many believe that's because of the fact that we've been in lockdown. So we'll see what happens over the next week or so as we start to ease lockdown. The other thing that we want to highlight is that our rates of testing, unfortunately, have also gone down. And this might be because the children are no longer in school. We're not sure. And as Holly said, now we all have access to test kits. We're encouraging as many of us as possible to book the tests online. And if you can help others in the community who are not sure or don't have access to the online testing, you can raise awareness about all the various locations in the community where they can pick up test kits. There are quite a few places dotted around, which are all available on the website. And we keep tweeting and highlighting those on the social media pages as well. So the rates of infection are not as good as they were the previous week. So we want to keep encouraging everybody to get a COVID test. And one other thing that we are reminding everyone, as we've said in previous seminars, is that the LFD test is only for people who do not have COVID-19 symptoms. So if you have COVID symptoms, you have to use a PCR test, which as well is easy to order online, or you can go into an area to a test site to do that. We have been keeping an eye on the other areas that I mentioned earlier, like the hospital admissions, which have dropped significantly. So now we only see about 11 new cases of COVID-19 across the hospitals in the city, which again is fantastic news. And the deaths are falling as well significantly. So I think overall, we are pretty confident that we are together collectively with all the effort that we're all putting in. We are fighting the COVID-19 pandemic, and we hope that we will achieve long-term success from this. So the sacrifices we're all making are making a difference. So the testing regularly, the hands, keeping our hands clean, making sure that we're wearing face coverings, making sure that we are maintaining our social distance, which has been extremely difficult, as we mentioned already. And so it's just encouraging everybody, because it's a combination of all of these factors, as well as taking up the vaccine, that helps us a great deal. We know that people mixing indoors is a big problem when it comes to COVID-19 spreading. And that's why the roadmap currently as the point we are at does not allow people to mix indoors. So moving to the requirements of the roadmap. So currently we're in stage 2. Thankfully, leisure centers have opened up. People can get more physical activity, and this we hope is happening safely. If you do know of any places where they're not following the guidelines, or you feel that you've gone there and you weren't happy with the level of cleaning or spacing, that do highlight those, because we have COVID marshals who are moving around the city and working with businesses to keep us all safe. So the expectation is that they are open and people can go in, but when you're in the leisure centers or the gyms, you have to maintain the social distance, and they should have everything signposted. Apart from those sort of places, and perhaps when you go into the mosques or the churches or other faith settings or the temple, we expect people really not to be mixing indoors in each other's homes, where we've seen historically, that's where the infection spreads the most. And so it's making sure that we maintain the rule of 6, only 2 households or up to 6 people can meet outdoors. And even when you meet outdoors, you have to be socially distanced. You're able to access your normal support groups, and up to 15 people can meet for support groups if that's the case, and people need that support to keep them going. For those with children, whilst we're still in the Easter holidays, theme parks are open, and again, the rules are there, and they should have put in place the measures to keep everybody safe. So we've been tweeting about some of the outdoor attractions available in the city to families. The other areas that are open are libraries and community centers, which again, I'm aware that I have put in place the measures to keep people safe. Many of us have probably managed to get a haircut by now, or go to the hairdressers, or had our nails done. So all those usual places are also open now and should be following the COVID rules. Retail shops are open, and I think for the retail industry, it's been a really difficult time. And so we value the businesses, and they should be following the rules, and they've had access, like many other businesses, to LFT testing and can have access to that regularly to keep the staff and everyone safe. Restaurants are open as well for outdoor dining. And according to the guidance, you can have children's activities for up to 15 people, parents, indoors, but those have to be in places that are recognized as set up with the risk assessment to offer those services. So registered venues, so not people's homes or just a space that isn't COVID compliant. There's also opportunity for certain events now, which are just pilots, and these are pilots because they just want to trial out and see what it's like to have large crowds of people coming together. So the learning from that will hopefully help us when we move to step 3 of the roadmap. Another important area is weddings. As the weather improves, hopefully, we hope that there will be more opportunity to have weddings with larger groups, but for now, up to 15 can attend weddings and receptions, and up to 30 can attend a funeral. And then lastly, I think one area I wanted to highlight was travel, which I think has been a huge area, because many of us would love to go on a holiday, and particularly go somewhere where it's nice and warm. And for now, we can't, but I know that we're keeping an eye on that. So we've been told to minimize travel, and we've been told definitely that we can't have international holidays yet. But just to remind everyone as well that all the things we're doing, all the safety measures we're taking now as we ease lockdown, will help us a great deal when it's time for us to hopefully have a proper holiday over the next couple of months. So as much as possible, we need to continue to follow those rules, so that the rates of infection can continue to go down even after we raise the lockdown, and ensure that as many people as possible as well take up the vaccine, which I know Dr. Riesman will elaborate on when he does his talk. I think that's me done, and happy to take any questions. Thank you, Holly.
Thank you, Madupe. And we've got a couple of questions from Diana. So one of them is, does a baby of 11 months count in the rule of 6?
That's a very good question. There's always one, isn't it? Okay, so my understanding from the previous guidance, and I can, whilst we're doing the others, I can do a quick glance because I haven't looked at it in this week to see if it's been updated, that children under a certain age were not included when we did the rule of 6. So I can have a quick look while we're on the call, because I know I've seen this before, unless there's someone else who has the guidance and can confirm that. I think children, and definitely babies, who don't count towards the rule of 6, as far as I'm aware of it, but there's a certain limit or cap on the age. So I just need to clarify that to you.
Thank you. Whilst you're looking at that, Madupe, Diana, do you want to read your other question out loud? Because I read it, but I just want to make sure that I'm asking it, the way that it's intended.
I know we're allowed a maximum of 6 in a garden.
Yeah.
But I had assumed if 2 happened to be in the house, then only 4 could come in the garden, while a number of people at a group I was at disagreed with this and thought that if there were 1 or 2 in the house, then you could have more, you could still have 6 in the garden. And it's actually a dancing group. I belong to a group, we dance, but we're socially distanced, we don't touch, and we wear masks. So we're doing everything in the garden. And I just felt inside and outside had to be the 6.
Right.
Sorry, Madupe, you go.
Yeah, well, so it's the rule of 6 or 2 households. So the thinking behind that is we're limiting the number of people who are not already part of what we used to call a bubble from mixing with each other to minimize the risk of spreading. Because you imagine those 6 people then go off into their normal groups and they could be potentially spreading if they've picked up infection from their interaction at that time. So it should be 6 altogether in that area, because if it's part of the dance group, then it would be 6. But also bearing in mind, support groups of up to 15 people can meet. So that could be more of a support group, or a group, an established group of people coming together to perform a function, which will be up to 15, rather than thinking of it as a 6 people indoors and 6 people outdoors. If you're there to do the dancing, it's more about the rule of up to 15. But that has to take place, as I mentioned earlier, in a registered premises, not in, that can't be in someone's home or garden, as my understanding of the guidance.
That was me too. It was just someone disagreed. And I thought,
I think you're definitely right on that. Your understanding of that is the correct thing. And just to say, I've just spotted that when it comes to, so before the guidance did suggest that children under a certain age could be exempt from the 6, but now it says all children. So the only people who you wouldn't count in the rule of 6 would be perhaps nannies or people who are supporting the children within a setting. But all children of any age group are included in the rule of 6, is my understanding. And if you imagine, I think the other part of that guidance talks about 2 households. So you could have 2 households mixing, where there's 7 in one household and 8 in the other household. So that's 15. As I mentioned earlier, that's fine because they're all part of a bubble. They're all going to come anyway together and then live together in that bubble. But if it's 6 people who are not part of an established household, then you can't have more than 6, including children.
fine.
Thank you. Does anybody else have any questions before we move on? We haven't got any more in the chat box, but please do feel free to say them if you do have any more.
Ollie, can you hear me?
Yes, hi Mike, hi.
Yeah. Hi. I registered our voluntary company to get COVID tests sent, because we've got over 10 employees.
Yeah.
But in fact, they haven't arrived. I've not heard anything about this, but now we can order them individually, and I've got mine today. I mean, should I encourage everybody now to order them individually?
Great question. Madupe, do you know what's better, to do it as a business or as an individual?
I think because the reality is that we're going to be living with COVID for a long time to come. I think this is where we're working towards, which is why we're all now able to order a test. We're all being encouraged to take the vaccine when we're offered. It sounds like it's better to get everybody independently doing this, getting used to, I was saying this in a meeting earlier this week, doing COVID testing routinely, almost like waking up and brushing your teeth and getting dressed. That's the point I think we should be getting to. So I would encourage as many people who can to go online and book the test, and where they can't, there are other ways. I don't think that you might be able to book them depending on your situation and your organization. So do let us know, because we can signpost you to that as well, if there are people you feel you would rather book for. But for now, definitely encourage as many people as possible to start to book their own tests online if they can.
Thank you.
Okay, thank you.
Does anybody else have any final questions? No, I mean, if you do, we're still here, so don't worry. I think on that note, Rizwan, have you got a presentation for us about the vaccine?
Yes, I do. I have a very small presentation, to be fair. So bear with me. I'll just get myself sorted.
You haven't got your little helper today.
Yeah, she's playing.
Oh, bless her.
So basically, I just wanted to give a bit of an update regarding the vaccination. Hello, everybody. And I'm one of the ones who braved up barbers, got my haircut finally after 3 months. Yeah, so regarding vaccinations and where we are, and basically give a brief update. So starting off with national figures, as of yesterday, which is 14th of April, 2021, the total number of cumulative doses of COVID-19 vaccines were just over 34,300,000, of which 27,250,000 were first doses and 7 million were second doses. Coming on to the Midlands, 5.29 million were first doses, 1.24 million were second doses, which gives us a cumulative count of 6.54 million across the Midlands, which actually puts us in the lead again compared to all the other regions of England. We're, hey, doing well. So that's good. Specifically now looking at Birmingham.
Oh, I'm so sorry to interrupt, Rizwan. Sharon just popped in the chat that you can't see the slides. Is that the case for everybody? Just want to make sure everyone can see.
I can see them.
Yeah, I can see them.
We can send you perhaps a copy of them, Sharon, after this, if that's okay. Is that okay with you, Rizwan?
Yeah, that's fine, no problem.
Sure.
Yeah, so basically looking at the scores on the door, essentially for Birmingham now, total number of administered vaccinations have been just over 1 million. In that, 648,000 were given in the hospital sites, 88,000, sorry, in the BSOL sites rather, 88,000 in the hospital and the local vaccination centers, which is the GP surgeries and pharmacies and everywhere else, is about 458,000, with 101,000 coming from the vaccination centers, which were the mass vaccination centers, which was essentially in the Aston Villa and the Millennium side. So the scores at the doors, again, we're looking at the risk groups, and you can see that as we go down the risk groups, the percentages go down, but our over 80s have been around about 89.64% for the first dose on the uptake, and 60% on the scores for the second uptake. That is only being superseded by the care homes, which is 96% and 64% respectively. And you can see that as we're working down the cohorts for second doses, there is a disparity between 60 and 35% and 17% and so on. So we are working in the order of the vaccine that was given, hence the age range disparities for the second doses. But this was as of last week, so numbers have obviously changed further. The variation in the amount of vaccination uptake remains pretty much the same per ward, in that West Birmingham, Alum Rock, and some areas of East Birmingham are now still showing a lower uptake, all being well that they have actually caught up from the percentages of low uptake from previous to current. So people are now mobilizing and we are improving. And we are now currently around about the 70% mark for the lowest uptake, and obviously well over 96% for the highest uptake in per wards, which is excellent news. And in terms of the sites, we now have 40 sites and counting. So we have the hospital hubs, we have the mass vaccination sites, we have GP surgeries, which are doing them as hubs. The community trust is going out, the mental health trust is going out. Obviously, there have been some works being done in prison, in mobile vaccination sites, and we're obviously now also giving extended family members of those who are vulnerable the vaccination as well. The one exciting thing which worked quite well last week was the site at JLR, because they're a massive employer in the West Midlands. The UHB hospital site decided to take a mobile unit there, and they've got quite big numbers of vaccination done as per the cohorts in the JLR site already. So that's really my update so far. I think on the whole, things are looking quite good. We're now down to the age of 45 and above. And obviously, we should be working down towards 40s within the next few weeks. And then obviously after that, well, the first thing is that we've already made good progress in that the initial deadline was to get to the over 50s by the end of April, which we've now done already. So by the middle of April. So things are moving on at quite a pace, and I'm hoping that the rest of the cohorts will probably follow very, very soon.
Thank you, Rizwan. And before I open it up to the floor, I just wondered perhaps if you could talk to us quickly about what's been in the media around the AstraZeneca vaccine and clotting, because I know that a lot of people have been anxious about it. You know, of course they will be. Just hoping if you could, just talk us through it a little bit.
Yes, so I think like Jonathan Van Tam said, these are really fine-tuning sort of things, and this is really a course direction change as opposed to a mass change of what vaccination is suitable or safe. I think we have found that there is obviously a little bit of a risk in certain age groups, and I think as a result, we're looking, I think obviously the NHS and public health are looking into this, and so are the drug companies. But as a result, what was initially thought by the MHRA and all the other regulatory agencies was to perhaps avoid this avoidable risk in those age groups and use an alternative vaccine. Now, Moderna has come into circulation, and we still have the Pfizer vaccination as well. And we were already using the Pfizer vaccination for the 17 and 18-year-olds who are at risk as a preference anyway. So I think this is just a minor course change with preference for under 35s to be on Pfizer rather than on AstraZeneca.
Thank you. Sue's got a question as well around sort of the number of people that actually just don't want to have the vaccine? Do we have that data, or do you know a figure at all?
No, we don't have the data because obviously there is no opt-out forms or anything like that. So we can only extrapolate the number of those who don't want to have the vaccine from those who actually have it minus the population size.
Oh, somebody got a question?
Yes, I've got a question.
Oh, sure.
Yeah,
Go ahead.
good afternoon, Rizwan. Thank you very much for your presentation. It's very helpful. As you know, there's already a reservation about the uptake of vaccination within the Asian community generally. The fact that the Oxford AstraZeneca publicity around blood clots hasn't helped that cause. I wondered, in view of that, whether there's any possibility that we can, do people have a choice? For example, we're trying to encourage people to have the vaccination, but they say, oh, I want Pfizer vaccination because that's more safer. Is there anything we can do around that so if people do want to uptake the vaccination program in the Asian community, they have a choice?
I think this question is really above my pay grade in the sense that unfortunately we can't control the supply of the vaccines as such, but it's an interesting concept that is coming up, and it is something that we have seen on the front line as general practitioners doing the vaccines as well. And it's a phenomenon I now call vaccine selectivism, in that people only want the Pfizer vaccine or only want a particular vaccine for choice. Unfortunately, because of procurement issues, we can't give a choice. We have to give what we have been given from the Department of Health and the government. What we try to do is we try to accommodate people wherever possible. Now, the Pfizer vaccine supplies at the moment have only been coming for the second doses for those who have had the Pfizer vaccine as first doses. So, and also they've been coming for the at-risk groups for 17 and 18-year-olds. So I think we are limited because of the numbers that we get. Of course, if we have any spare, then we will offer them to those who want a preferential vaccine out of choice. But the message still remains the same. The risk of having a blood clot with the AstraZeneca vaccine is very, very, very minor, and that your risk of having a blood clot with a contraceptive pill, for instance, is much more higher as comparison to having that from the vaccine itself. So on the whole, I think the vaccine remains remains safe. It remains very, very effective. I mean, you must have heard of all the effectiveness studies that have been published by PHE in preventing serious illness, in preventing death and hospitalization, and also to some degree transmission of the virus itself as well. So I think we have to take a balanced approach on this. But obviously, wherever we can help, we will help. Thank you very much indeed for that. Thank you.
Thank you both. Does anybody have any feedback perhaps from their community about the vaccine, good or bad, that it might be worth sharing with Rizwan and ourselves? It'd be great to get some feedback.
What I've done as a champion is at my local surgery, I've actually recorded a just over a minute message about encouraging people, and it's in Alam Rock area, to encourage people to uptake the vaccination. And I think, you know, I know some colleagues of mine through Birmingham, they've also done similar, their own local practices, trying to record a message in Urdu, for example, and English, so people have an awareness of it. And there, from my understanding, there has been a degree of uptake as a result of that campaign.
Indeed, there has been, and thank you very much for your efforts. If you are going to do any further videos or promotion, what I would also suggest that another message which can go out, particularly to the Muslim community, is that it is okay to have your vaccination during your fast, because a lot of people at the moment are avoiding having that, either because of side effects or because they feel that their fasts are invalidated because of the injection. I know BIMA has looked into this, and so have a few other religious authorities, and they have said that it is okay. Now, obviously, it's a personal choice. We can't force anyone, but it's a good message to share. Yes, thank you for that. I did see that last night, actually reading. So that's something, obviously, we will communicate as we come in contact with people. Thank you. Thanks.
Something else I just want to quickly touch on as well. I mean, I know that we've spoken about it before, but I know that we have got some new people on the call. So some people have been saying that they've had quite bad side effects from perhaps the first vaccine, and they're debating about perhaps not even getting the second. Do you have sort of any words or sort of anything that you know, us as champions we can do to help those individuals?
Yes, well? Yes, there is. So I think you're not the only ones if you have had a bad reaction to the vaccine. And personally, as a GP, I've already dealt with about 2 or 3 cases where people have had an alternative vaccination to their first one after having discussed it with our colleagues who are specialists in this area. Of course, we can't endorse a second vaccination which is different from the first one, but in cases where there have been severe side effects, this has been possible. So my message to anyone would be speak to your GP and they will deal with your concerns on an individual basis.
Thank you. I'm just checking the chat for any further questions. So Sue's asked, now I think it's I guess good to say here that I think I was reading earlier the chance of getting a clot from the vaccine is something like 4 in a million, or so you know, it really is crazy. But Sue has put in the chat sort of what are the things that you know, if someone has a clot, what would the symptoms be? You know, just what people look out for.
So if I could just say, Holly,
sure.
Before you answer that question, it's actually come up several times, people going actually for their second vaccination and wanted to know what to look for. And it did come out of a particular GP surgery where when they went, they actually asked and didn't really get a response. So they came away actually more nervous. So this is something actually that publicly we might need to know. I agree with you, Holly, it's very slim chance, but if the questions are being asked, I think we need to be careful so that people do carry on taking up the vaccine.
Definitely.
Indeed.
I mean, yeah, definitely.
Indeed. Absolutely agreed with that. So I think that the things to look out for, and these are clots in the brain, essentially. So there will be some neurological symptoms. Now, headache can be an early warning symptom, but you can also get a headache from the vaccine itself. Now, what we usually say that headaches for up to 4 days, which are mild, which are not debilitating, and we do not have any other neurological symptoms. For instance, dizziness, for instance, numbness or vision problems or anything like that are okay. You can just take some paracetamol and hopefully they should be fairly minor and should not be of any consequence. Obviously, if you have any further symptoms apart from the headache, so in terms of either blurred vision or tingling or numbness somewhere or anything like that, then obviously get in touch with your GP straight away. Do not wait for the 4 days. And obviously headaches persisting more than 4 days, which are severe, are something that are of concern as well. But thankfully, they're very, very rare.
Thank you, and thanks Sue for raising that as well, because you're absolutely right. Even though we all know the risk is so low, but if people are asking questions and perhaps not getting the answer, people will feel a bit on edge. So yeah, thank you for raising that.
Can I just add one more thing to that, Holly? To that, it's just saying that so the 79 clotting events, which, as Dr. Rizwan said, they were extremely rare, which were observed were after the first dose of the vaccine. So if anyone's already had the first dose, didn't have that, then please have your second dose, because so far the evidence, although they say that, and this is back to what we've always said, that sometimes you're doomed if you do and you're damned if you don't, is the problem we have now, because we live in a very technological age and we're very good at finding information. In the early days of vaccination programs for some of the diseases we've eradicated, we never had a way of checking, isn't it, Dr. Rizwan?
No, of course not.
What happened to people after they had the vaccine? There were no yellow card reporting system. So these are the headaches you get when you lived in advanced societies where, and it's all part of the ethical, what we call the ethical dilemma of wanting to make sure you're doing what's right by people and sharing information. But information is meant to empower you as community champions and the people that you represent. So I think do let the community know that it isn't that this information is meant to scare people. You know, the people who have produced this findings, I was reading in detail the first clinician who said they'd observed these clotting events, saying, you know, we weren't sure, and we even now MHRA have not said specifically that this vaccine caused the events. They said it's plausible, and this is what's been observed, but they would have stopped the vaccination program if it was felt that. Absolutely. So the fact that this is carried on is reassuring in itself, and the evidence of those 79 extremely rare clotting events was after that first dose of the vaccine. And so if you've had the first dose and you haven't had a clotting event, then do have your second dose, so long as it's within the criteria your GP or whoever will advise you, because they have given further guidance about who should have it going forward. I thought I'd add that just
No, thank you.
clarify.
Thank you very much for that.
Thank
and
you.
Also, just to put things into perspective, I think the blood clot risk for the COVID vaccine, the AstraZeneca vaccine, is 3 in 1 million. Whereas for ladies who are not taking any hormonal contraception, it's 2 in 10,000. So that would be that sort of indication of a basal population risk. For those who are on the combined oral contraceptive pill, it's 5 to 12 per 10,000. And for pregnancy and up to 6 weeks postnatal, it's 1 per 2 for every 1,000 patients. So I think in terms of comparison, I mean, obviously every clot is devastating and every clot is a complication that should be avoided if possible. But in terms of comparison, it is way, way low compared to other daily life events that we would undertake.
Thank you. Thank you so much for that context. I think it is really, really helpful. And Deborah, you've got your hand up as well.
Yeah, it was just to say, I took my mother-in-law last week to Edgbaston Cricket Ground for her second vaccination. They were extremely thorough and went through any side effects, etc. And my second vaccination, which was yesterday at my GP hub, again, they went through everything very thoroughly.
Oh, that's great. I'm so pleased to hear that, Deborah. It must be such a relief as well to know that they've been vaccinated.
Yes.
Thank you. If we haven't got any more questions, we can probably leave it there. I know we're actually 1 minute over. I would, if it's okay, Fiona, would love to finish on what you have put in the chat. Super. After my first dose, I had the best night's sleep since the pandemic began. I hadn't realised that I was particularly anxious about COVID, and I just think, yeah, I mean, I can totally see we've all had this anxiety about it for a very long time. We're in unprecedented times, so I imagine that relief of finally having it must have been amazing. It's lovely to hear these positive stories as well. So yeah, please do share them on social media and with your communities. It's fantastic. So I think we've got no more questions. We'll call it a day there. Please do email us though if you do. It's no problem whatsoever. We're more than happy to help. Thank you so much for joining us. The next meeting is on the 29th of April. So we'll hopefully see you then. And yes, have a lovely day and lovely evening. Take care all.
Thank you.
Yeah, all the best. Bye.
Thank you.
Thank you. Take care. Thank you.
Thank you.